Hey guys, Dr. Josh Jagoda here, and today we're going to discuss anterior pelvic tilts, also known as the lower cross syndrome, okay? You may have heard of this terminology, but it is really common and easily seen in a lot of people out there. So there are some drawbacks to having this type of presentation, and we are going to discuss pretty much the anatomy as well as the orientation and the position of the anterior pelvic tilt today. So when we're talking about an anterior pelvic tilt, we're talking about the pelvis dipping forward just like this. So the presentation in my body would be as if we were going from the side like this, and then it would tip forward just like this. So that's what we're doing when we tip this forward. Now, when we're discussing anterior pelvic tilt, it is important to talk about the presentation and the response of the muscles, okay? So the first thing we're going to do is we're going to talk about the low back muscles. So the low back muscles run up and down the spine just like this. And if you're going to anteriorly tilt the pelvis, it approximates or brings these two areas closer together, meaning it's going to tighten the lower back. So a lot of people with anterior pelvic tilts have this excessive lordosis or lumbar curve in the spine just like this, and then what they'll do is they'll complain of low back pain as well as excessively tight muscles. The next thing that's going to be excessively tight is the hip flexors. Now, not shown on this model here is the actual femur and the head of the femur, but you have the iliopsoas or the psoas muscle that comes down and attaches to the anterior and lateral aspects of the vertebral bodies here, and what will happen is they'll go right down and they'll insert right onto the hip right here. So excessive sitting will approximate these two surfaces right here and here closer together again. So we have excessively tight low back muscles, excessively tight hip flexor muscles. As a result of these hip flexor muscles tensioning up and tightening up, again in combination with these muscles, it will pull this pelvis into this anterior position. So those muscles are tight on this side and tight on this side. And as a result of that, you're going to have weakened and stretched abdominal or core muscles, as well as weakened and stretched glute muscles, because you're sitting on these muscles all day long due to sitting and things like that. You are going to notice that these two, so that's why they call it a lower crossed, because this muscle here, which is the rectus abdominis, is going to be weak. This muscle here, which is the glute max, is going to be weak, and then this muscle is going to be tight, and this muscle is going to be tight. So again, it is going to present laterally like this, and then you're going to come like this. So the muscles here are going to be weak, and these are going to be excessively tight, and these are going to be excessively tight. So what's a really cool and common presentation is that patients will come in and be like, my hamstrings are always so tight. Why are they always so tight? It doesn't matter how much I stretch, I always feel tightness into the hamstrings here. So, which is interesting enough, right? When you have a dipped or a tipped pelvis anteriorly, what's going to happen is that, again, these muscles will pull up, and as a result, the ischium, or where the hamstring muscles insert, are right into the sits bones here. So that's what we call them, the ischium, or the ischial tuberosities here. And so what we'll notice is that as you dip your pelvis forward, what's going to happen is that the ischium is going to ride superiorly like this. So if I take a step back a little bit, you're going to notice it taking a superior kind of presentation, which is going to take the hamstring muscles. If you envision these as a hamstring muscles, they're going to ride up like this. So that's an anterior pelvic tilt. The whole presentation that you do not want, which can be a huge cause for low back pain as a result, and as well as excessively tight hamstring muscles. So sitting is going to propagate this and increase it. Again, when this migrates superiorly, where the attachment of the hamstring is going to be, people will present as extraordinarily tight, and they'll try to stretch their hamstrings. The problem with stretching their hamstring is that finally, let's just say over time, you finally loosen up these hamstrings here. Well, that's going to provide a little bit more slack for the pelvic area to rotate even further and further and further into that anterior pelvic tilt. And that is a huge problem, because what you're doing is you're trying to say, hey, I'm really tight, I'm really, really tight, let's stretch out a muscle that's tight, but you're stretching out the wrong muscle, and then you're thus further complicating this type of presentation. So really what you need to do is strengthen the stuff that is weak and loosen the stuff that is tight, right? Makes sense. So what you're going to want to do is loosen the tight muscles, which is the hip flexors, as well as the low back muscles, and strengthen the abdominals and the glutes on this side and this side. And that will give you a better presentation of taking that pelvis from an anterior position to a little bit more posterior, and finding that neutral spine. So here would be an anterior presentation, and a posterior presentation would be a little bit more like that. So you can see. So a great common visualization is if you are walking straight and you see the belt buckle. If it is pointing downward like this, I should say like this a little bit more, you're going to notice that there's a slight pelvic tilt anteriorly, which will be really, really well seen. So what you want to do is try to bring it up and come back. Again, you're going to have to strengthen these muscles. This is called a lower cross syndrome, or an anterior pelvic tilt. It is really, really complicated by excessive hip flexion, which is seen in a lot of seated postures. It can increase the presentation for SI discomfort, low back pain, hip pain, and just decrease your health overall. So what you really want to do is focus on stretching the tight muscles and strengthening the weakness, the weak muscles. Next episode, we're going to go over a few sets of exercises, how you can do that. So be able to check that video out, and we'll see you next time, guys. Hopefully this gives you a little bit of insight on an anterior pelvic tilt or lower cross syndrome. I'll see you next time.